Being a social worker is really not what I started out to be, but it has totally shaped how my life has evolved. I've been involved with child welfare now over 50 years, and it has totally changed what I do, where I go, what I studied, everything. Social work is very important in society. Whenever there's a problem, people always are saying, we've got to call a social worker.
Dr. Ann Coyne has spent a lifetime tackling and solving problems. She believes the teachings and practices of social work are more essential than ever to the United States' future and to the world.
I think that social work's vision of equity, equality of opportunities are going to be very, very necessary here, because there is less equality now than I've seen in 50 years. We are slowly but surely, as we separate into the very rich and a lot of poor, are becoming like a third world country.
Ann knows this from her own experience. As a child welfare advocate and social work professor, Ann has her feet firmly planted in both the world of academics as well as the pragmatic aspects of international development, a path she credits to an auspicious trip to Nicaragua.
I got involved in Nicaragua in 1984 with a Witness for Peace program, and when I got down there and saw what was going on, I thought, well, I have to come back here. So went back in 86, and then decided to do my sabbatical there in 1990 and to study the child welfare system in Nicaragua. So that's really what got me started, and I've gone every year at least once, sometimes 2 and 3 times since 1990.
Through Ann's efforts in the early 90s, the University of Nebraska at Omaha formed a sister school relationship with the National University of Nicaragua, Leon. Many of Ann's students now travel with her and do internships in Nicaragua, and through the local Rotary Club, she has engaged the Omaha community in this partnership.
I've been a member of Rotary since 1991, and the Rotary Club has been heavily involved with the projects that we do in Nicaragua. We've brought people here for medical attention. We have shipped beds down to the hospitals down there. We have built a maternal and child health clinic, and we built 72 houses for very, very poor people. And we also have started a school for deaf children.
But perhaps no lives have been touched more by Ann, or are closer to her heart, than the special needs children she meets in Nicaraguan orphanages. Through perseverance and international adoption efforts, she has been able to find many of them good homes.
Katie, the youngster with the double cleft palate, was the first one, and then 18 children later, Hector, who has brittle bone disease, and both of those children are placed here in Omaha, and both call me Grandma. What do you think?
Clearly, it is her passion for young people that makes Ann so powerful.
What I really want my students to carry out into the world is a huge commitment to people. Whether they're disabled, whether they're old, whether they're babies, whether they're working, whether they're unemployed, all different kinds of people that society is made up of, to be really dedicated to them and like them.
Yet despite how much she has given, Ann has no thoughts of slowing down.
What keeps me going and why I don't retire is that I really enjoy what I do, and I really think that I can make a difference. I mean, what better life is there than to be hanging out with all these young, enthusiastic students? Why would I retire? Why would I stop? I don't know what people do when they retire, but I have the best life.